We're gathered here today to hear about the most complicated of subjects from one of the most enlightened of minds. Professor Sheldon Danziger, the Henry J. Meyer Distinguished University Professor of Public Policy, is known throughout the world as an exceptional scholar of poverty and social welfare. And just as he has widened our understanding of poverty by showing us its many facets and ramifications, Professor Danziger has many sides to him that I want to share with you this afternoon. Many know him as a brilliant researcher. He has taken the difficult, complex, and emotional subject of poverty and viewed it through myriad lenses, because impoverishment cannot be explained or remedied in simple fashion. Whether focusing on children in poverty, the elderly poor, family poverty, or welfare reform, Professor Danziger explores these issues as an economist, a social worker, a political scientist, a demographer, a lawyer, and a policy expert. He embodies multidisciplinarity, and he is a tremendous model for faculty and graduate students at Michigan and beyond. His dean and colleague, Rebecca Blank, of the Gerald R. Ford School of Public Policy, is first to acknowledge his deftness at crossing boundaries. No one, she says, would list Sheldon as the top economist working on poverty because only some of his work is economics. Although much of his work is heavily cited by sociologists, no one would list him as the top sociologist in the field. If asked to list the 5 top people working on poverty in a first world context, however, Sheldon's name would appear on every list. Others relate best to Professor Danziger as an outstanding and prolific writer and editor, someone who is able to take seemingly inaccessible research findings and give them life with taut, crisp language, destined to provoke discussion and debate. Among the 13 books he has written or edited is the influential trio of volumes he organized and co-edited: Fighting Poverty, Confronting Poverty, and Understanding Poverty. They are staples in the library of any respectable social scientist. Still, others see Professor Danziger as a brilliant teacher and mentor, and for this I want to share with you the observations of one of his colleagues. To enter the neighborhood of Danziger's office at any time during the day is to descend into subtly ordered chaos. 5 or more students are feverishly interacting with each other and with Danziger, who is on the phone. At least 3 different projects are under discussion. Second-year students are collecting data and running regressions. Third-year students are offering suggestions to second-year students. Fourth-year students are above the fray, hard at work on their own dissertations, but offering advice when needed and taking advice which is freely offered. This is a portrait of a professor reveling in the academy and all it offers to our faculty: research, teaching, mentoring, and collegiality. Perhaps Professor Danziger's most significant contribution in a career that knows few limits is the research and training program on poverty and public policy, which he established 15 years ago for minority postdoctoral scholars engaged in poverty research. As director, he mentors up to 5 postdocs a year and helps them establish themselves in universities across the country. As vice president at the Ford Foundation, which supports this program, says Professor Danziger's work has led to the creation of an entire new generation of scholars who are creating literature on poverty and public policy. I can't think of a more lasting testament to one's work. It's time for me to stop talking, though, so instead we may all listen to the words and wisdom of Professor Danziger. Please join me in welcoming the Henry J. Meyer Distinguished University Professor of Public Policy, Dr. Sheldon Danziger.
Thank you. Thank you, President Coleman. It's indeed an honor. And I thought before I would start, I should acknowledge some former students and colleagues without whose support I wouldn't be here. I especially want to thank Dean Becky Blank, both for nominating me and for being a leading poverty research scholar who gave me hard questions on the first draft of this talk. But all the leadership at the Ford School since I've been here, Edie Goldenberg, Paul Courant, and Ned Gramlich, faculty members at the Ford School and the Population Studies Center, people who I've especially been close to in teaching and writing, Mary Corcoran, Ren Farley, and Jeff Lehman, all of whom are here, and I'm really pleased. I had the chance to start my career at the University of Wisconsin as a postdoc, worked with a number of people there, and in particular, one of my key mentors, Eugene Smolensky, taught me two important lessons that I've tried to follow. One is give your students and postdocs full credit for their contributions, because within a few years of their training, they'll know a lot more than you. So treat them right when you know a little bit more than them. And the second, it's better to help young scholars publish and start their own career than to write another paper of your own, that you make more of a mark on the profession when you do that. And I've tried to carry that with me. Another key collaborator who couldn't be here is my colleague Peter Gottschalk of Boston College. When I came to Ann Arbor in 1988, Dean Harold Johnson allowed Mary Corcoran and I to co-teach a seminar which still is running, and that many of the students who you mentioned were able to participate in. Another important event was an award from President Duderstadt's Presidential Initiatives Fund in 1989, and Jeff Lehman and I and Mary and Paul and a number of others were involved in that. And that gave us a launching pad for a lot of projects, including the research and training program you mentioned. A second initiatives grant from President Duderstadt set up the Michigan Program on Poverty and Social Policy, which is directed by Sandra Danziger and led to our recent women's employment study. In 2002, all of these research projects came together in the Ford School with the establishment of the National Poverty Center, which Becky Blank and I co-direct, and are assisted by program manager Laura Lee and assistant director Kristen Seefeld. Michigan's been just a wonderful place to do research, and I particularly appreciate the opportunity I've had to mentor students and fellows, and I want to just mention three who came today for the talk: Maria Kanchan from the University of Wisconsin-Madison, Ariel Khalil from the University of Chicago, and Rook Mali-Jayakoti from Penn State, all of whom are important poverty researchers in a new generation. Finally, I want to acknowledge my children, Jacob and Anna, who are here. They welcomed the chance to skip classes at Mills Graduate School and Barnard College to be here. And my wife, Sandra Danziger. We've both been married a long time and collaborated on a number of major research projects, but she gets a lot of credit because she's the one who said, it's time to leave, we're moving to Michigan. So let me talk a little bit about poverty. Following World War II, the American economy experienced a remarkable quarter century of rapid economic growth, rising real wages across the distribution, and low unemployment rates. This was the era when the soundbite, "a rising tide lifts all boats," was clearly true. Nonetheless, in the mid-'60s, there were calls for the government to do more than it had been doing to reduce poverty. And I put up a quote from Michael Harrington. I'm not going to read the detail, but this was emblematic of an important position that expresses moral indignation in a nation with a technology that could provide every citizen with a decent life. It is an outrage and a scandal that there should be such social misery. And the story goes that Harrington's book had a very important impact on President Kennedy, who had observed poverty firsthand when he campaigned in West Virginia during the primaries. And he set in place a group of economic advisors, one of whom was my former mentor, the late Robert Lampman. And economists at the time thought that they had mastered the business cycle through monetary and fiscal policies, and so they could put economic analysis to use in fighting poverty. The next quote is indicative of that view. This is from a testimony by Lampman to the Joint Economic Committee. And the key point of it is in the middle, where basically he views anti-poverty policies as a supplement to economic policies. Particularly the sentence, "This should be supplemented by special private and public programs for those groups who do not readily share in the benefits of economic progress." Johnson was moved by both the moral and the economic arguments and declared war on poverty, drawing on both the moral and the economic arguments. The italicized sentence, "We know what must be done, and this nation of abundance can truly afford to do it," and the line from The Economist that economic growth alone was not sufficient, the last line, "but general prosperity and growth leave untouched many of the roots of human poverty." So with this background, it's obvious from the standpoint of 40 years later that poverty was not eliminated the way the War on Poverty advisors thought. Some critics blame anti-poverty programs themselves for the failure of poverty to fall. And a famous line from a President Reagan radio address, "Poverty won the war. Poverty won in part because instead of helping the poor, government programs ruptured the bonds holding poor families together." Other critics of anti-poverty policies have suggested that it's now more appropriate to focus on the personal behaviors of the poor rather than on their lack of income. I want to argue today that the research which I'll review suggests that poverty persists because the optimistic but reasonable economic forecasts of the best poverty researchers in the late 1960s and early 1970s were validated by unexpected economic changes that began in the early 1970s. I reject the view that poverty remains high primarily because government provided too much aid for the poor and thereby encouraged dysfunctional labor market and marital behaviors. So I document that poverty persists not because of failure of government, because of a failure of the economy to deliver the benefits of prosperity to all workers, and because politicians and the public have lost faith in the ability of government to implement needed anti-poverty policies. The era of rising real wages for most workers and the steady economic growth that had raised living standards from the end of World War II to the early 1970s came to an abrupt end. One doesn't have to say this very loudly in Michigan, but particularly hard hit were workers with a high school degree or less, whose economic gains in the quarter century following World War II were largely based on well-paid, unionized manufacturing jobs. For the last 3 decades, obviously, these kinds of jobs for less skilled workers have disappeared. Most economists actually agree that a number of factors have contributed to the long-run changes in the labor market that I'm going to talk about, but being economists, they of course disagree over which one is more important. So I'm not going to enter that debate. I'm just going to list a set of items, and I think most of my colleagues would agree that all of them have at least some role, even though they would argue for long about which one is big and which one is small. These changes include labor-saving technological changes that have increased the demand for more skilled workers, global competition, which has reduced the demand for goods produced by production workers in the U.S. and substituted those goods produced by workers in other countries. Immigration has increased the size of the low-wage workforce and increased competition for the low-skilled jobs that remain. Institutional changes, such as a declining minimum wage and shrinking unionization, also contributed to the economic insecurity of less skilled workers. In the 40 years since declaration of the war on poverty, progress has been very slow, except for one group, and I should mention that group now, and that's the elderly. Poverty among the elderly declined dramatically as they gained health insurance through Medicare and rapid increases in the value of their Social Security benefits. At the same time the economy turned against less skilled workers, the elderly for the first time were benefiting from Social Security benefits that was indexed for inflation. I think it's pretty obvious that fighting poverty has slipped as a national priority. It had its 15 minutes of focus this fall after Hurricane Katrina, but as far as I can tell, it's a renewed anti-poverty initiative is not on the table. I am going to end on an optimistic note. I want to document that several market-oriented anti-poverty policies developed in the U.S. over the last 4 decades were successfully implemented in the United Kingdom in the late 1990s by the government of Prime Minister Blair, and that poverty has fallen dramatically in just a few years because of these initiatives. So my optimism is if we can find the political will to launch a new anti-poverty initiatives, we could re-import these policies and reduce our own poverty rate. With that as introduction, I thought I should try to document my argument a little bit with reference to some data. This first slide shows roughly 3 measures of our living standards, real per capita GDP, and real per capita personal income measured both in the National Income and Product Accounts and the Current Population Survey. The only takeaway from this is that incomes today are a lot higher on average than they were. We certainly have had economic growth over this period. There's no doubt about that. The next one shows 3 measures of poverty, with the official poverty measure being the blue line in the middle. The measure at the top is probably one that many people who are critical of the official measure believe that the poverty line should be higher, so that's a measure with a higher poverty line. The one on the bottom is one that, again, many reasonable researchers think is important. It adds the value of non-cash government benefits, earned income tax credits, and other things that boost the income of the poor. I'm going to use the official line in the middle, in part because I think that if we both redefined the poverty line to be more appropriate for our time than the 1960s, and we added the value of these benefits, we would end up with a number like the official number. What's important to see, though, is you don't have the continuing decline in poverty on any of the measures that are there beyond 1973. So in this period, which included the War on Poverty years, poverty was declining rapidly to 11.1% in 1973, and basically it's cycled up and down through good times and bad times since. We've had substantial real income growth, but the poverty rate today is not much different than it was in 1973. So as the quote said, what did I do to prepare for the talk? One of my doctoral students, Brian Cadena, and I estimated some simple regressions with the official poverty rate. We allowed the coefficients to differ before and after 1973, and then we simply projected what would poverty have been if these changes had occurred. And before I show you the results, I thought I would use a quote from Robert Lampman, writing in 1971, the elimination of income poverty is usefully thought of as a one-time operation, that goal should be achieved before 1980. So Robert Lampman, James Tobin, the late Nobel Prize winner, and other very serious scholars were predicting the end of poverty as we know it. Well, what do our projections show? The green line says if the relationship between poverty and growth in living standards shown on the first slide had continued, we would have had a zero poverty rate under the official rate by 1983. So Lampman is pretty good on that. The second is that even if growth had slowed, but the relationship between growth and poverty had been the same, we would have eliminated poverty by 1987. So in my view, these simple projections, and they are consistent with more formal papers, one of which was published by Becky Blank and Alan Blinder in the early 80s, and one by Gottschalk and I, suggest that poverty persists, not because government did too much for the poor, but because this relationship between economic growth and poverty unraveled after the early 1970s. I think I'm going to skip this slide in the name of time, but basically point out that the visions of the war on poverty are much more consistent with the experience of the elderly, who obviously are not dependent on the economy. So in 1959, 1969, 1979, these are the periods when you get rapid increase in real Social Security benefits. You get a dramatic fall. And indeed, since about 1979, the poverty rates for the elderly have been the same or lower than non-working adults. And it's particularly remarkable when you think that over this period, the typical adult lives in a family in which there are more workers. Many more women are working today than was the case in the 1960s. So the typical non-elderly adult is more likely to be in a two-worker family today. So the elderly have made this progress in a period in which the non-elderly have been working more. I want to focus on the earnings of men, because my argument is that it's the labor market where these problems are coming from. These are actual data published by the census, and the good news is the red line, which says that at least for women, full-time, full-year workers, you see continued progress over this 45-year period. But I don't think anybody in 1973 who was talking about fighting poverty would have said, gee, 35 years from now, the median earnings, inflation adjusted, for full-time, full-year men is going to be the exact same as it was today. And the reason I think this group is important is because obviously full-time, full-year workers have not been discouraged from working by government programs. There's a story to be told about people who have dropped out of the labor force, and it is true that among some of the poor, one might say their economic hardship is because they have been reluctant to take available low-wage jobs. But you can't say that about full-time, full-year workers because they're already working full-time. Again, if one does a simple projection, if the pre-1973 trend had continued, these are just simple regression estimates, then when poverty grew from about 30,000 to about 40,000 between 60 and 73, if you just continue that, you'd have expected to see male earnings quite high. The situation for women is such that real earnings growth slowed down, but women have continued so that the gap between what would have happened had the pre-73 trend continued and what actually happened is relatively smaller than it is for men. Now, the group that has been really hard hit are men with no more than a high school degree. And this chart shows the relationship between what I call low earnings, that is, what percentage of these men earn less than the poverty line for a family of 4 in 2000. So all of this is put in $2,000, and persons who aren't working are excluded in this one. What you see is the blue line on their own. There was a decline from 63 to 73. It says in 73, 17% of men in this age and education group did not earn enough to support a family of 4 at the poverty line, which is equivalent to about $9.50 an hour. By today, it's 38% of these men. And this is the group that's been hardest hit by the economic changes. The high school graduate who formerly could go to work in a stable, unionized, high-wage job with health insurance and pensions is much more likely to end up in a service sector job at a much lower wages with much lower fringe benefits. Because, as I mentioned, wives have worked more over the period, the red line, which shows family earnings, is even lower, and the gap between the red line and the blue line is the reduction in this measure of low earnings due to other earners, which is mostly wives. 6 points here, 13 points here. So you see the extra earners are doing more. The bottom line adds government cash transfers, but again, an increase using this measure, 8% of these men lived in families with incomes below this constant line in 1973, 20% today. What I then do is to say, well, how can we sort out, in a relatively simple way, the role of economic change with another factor that has been discussed a lot in the poverty literature, that is changes in family structure and changes in the race-ethnic composition of the population. So, for example, just between 1975 and 2002, the percentage of persons living in families headed by non-elderly white, non-Hispanic males, which are the group with the lowest poverty rate, fell from 60 to 40% of all persons. So the next slide shows a very simple decomposition. The blue lines show what happened in the period from 1949 to 1969, and the yellow line shows 75 to 02. What you see is that growth was roughly twice as rapid between 49 and 69 as between 75 and 02. But during both periods, economic growth on its own was poverty reducing. So if there hadn't been any offsetting factors, poverty would have fallen over this period 75 to 02 by about another 6 percentage points. In this great boom after World War II, not only was everybody's income rising, but the incomes of those at the bottom were rising more than those at the top. Income inequality declined slightly. And in fact, one of the first projects I worked on in Wisconsin in the late 1970s was a project focused on why, if poverty has fallen so rapidly, has inequality fallen so little? And of course, being good forecasters, that was done just about the time when inequality had hit bottom, and it skyrocketed after that. So what you see here is that in the first period, since the incomes at the bottom were growing more rapidly than the incomes at top, income inequality was actually falling, and that was also contributing to reduced poverty reduction, whereas in the recent period, inequality was poverty increasing. And then there is an effect of demographic change. The effect was about 1 point the first period, 2 points the second period. What I want to argue is that the big difference is the slowdown in economic growth and the change in growth from being poverty reducing to poverty increasing. I should also point out that this is a place in the talk where Becky pointed out that the way Gottschalk and I have done the simulations may underestimate the effect of demographic change. Becky, of course, was right, and I went back and I did a simple back-of-the-envelope calculation, and if I redo this Becky's way, this might increase to 3.5 points. That's more of an increase, but again, I'm making the point that it was the reduction in growth and the change in growth from being inequality decreasing to being inequality increasing that's caused this. In fact, a simulation which simply says, what if incomes had grown without an increase in inequality over the last quarter century, and we still had the demographic change we had, that is, we still had more families headed by women, more immigrants and racial and ethnic minorities relative to whites. That simulation produces a poverty rate that is 5.2 percentage points below the current rate, so still a bigger effect than the larger demographic effect that Becky suggests. Well, if economic change is the culprit, why didn't we do something to reduce poverty and inequality through government? And one of the arguments is because we don't know what to do. Government doesn't know, poverty researchers don't know, and that's where I like to talk about the United Kingdom experience. Basically, my story is the labor market generates more poverty here, and I've shown you that. The government does less to reduce poverty here than it does in other countries, and I don't have time to show you the data, but if anybody wants to run out and read something tonight, there's a book by Rainwater and Smeating called Rich Children in Poor Countries. Basically, government does less here to reduce poverty. And contrary to popular opinion, the extent of intergenerational mobility here is, if anything, less than that in many other countries. And the best research on that is by Gary Solon here and Markus Jäntti, who's a colleague of mine, a former postdoc who's in Finland. So we are not exceptional in terms of the ability of the poor to escape poverty. We're exceptional in having a greater share of our population live in poverty. Now, one of the reasons is because Americans have never put as much stock in government as do the citizens of other countries. Ladd and Bowman review opinion polls from a number of countries and conclude, quote, Americans are inclined to the idea that opportunity is present to those who avail themselves of it. As a result, they are unsympathetic to government redistribution of wealth. A 1992 poll asked 2 questions in a number of countries. Do you agree or disagree that it's the responsibility of government to reduce the differences in income between people with high incomes and those with low incomes? And do you agree or disagree that the government should provide everyone with a guaranteed income? The percentage who agree here is less than in all the other countries, and particularly strikingly less than in the United Kingdom. And so that brings me to Prime Minister Blair. In 1999, Prime Minister Blair was presented with some studies. This is much like President Johnson being presented by studies by his researchers in the 1960s, which showed that the UK poverty rate was much greater than the poverty rate on the continent. And the UK in particular never likes to be second to France or Germany. And so Blair issued a Johnson-esque charge. He said, quote, "Our historic aim will be for ours to be the first generation to end child poverty, and it will take a generation. It is a 20-year mission, but I believe it can't be done." It can be done. Too much American views. The quote says it can be done. And what's remarkable is the policies he's put into place are based to a very significant extent on UK programs. Some of them are cases where the UK researchers came up to Wisconsin and looked at welfare reform in Wisconsin. They talked to poverty researchers here, and they went back, and I have a number of the key ones listed on the slide. Their soundbite was work for those who can, security for those who cannot. And in addition, there was a big focus on increasing investments in children and expanding opportunities to promote intergenerational mobility. Now, one of the major contrasts, and one which I will not advocate ought to be re-imported back to the U.S. because I know it would not play here, is that the Blair government actually increased cash welfare. That's, as part of their plan, they said, well, if we're going to end welfare as we know it for those who work, we have to do something for those who can't work. And they actually then put in higher cash benefits. But they put in something called the Working Families Tax Credit, which looks a lot like our Earned Income Tax Credit. They expanded a child care tax credit to a substantial amount. Now, we have a per capita child credit. Anybody in the room who earns a good wage and has a kid under 18 will benefit from that. But our per capita child credit does not benefit the poor because it's not refundable. They put in a national minimum wage for the first time, and a program like Sure Start, sure sounds like Head Start. What's remarkable is within a short period, this is all started in '99, they've decided to provide a child care place for all 3- and 4-year-olds, not just poor, all 3- and 4-year-olds who want a place in a public center. They can also be run by nonprofits with public funding, and the money on child care doubled. So a lot of these look like things that U.S. poverty researchers have been advocating. In total spending, it was about 1% of GDP, certainly not a huge amount. And, as I'll show in a minute, they've been very successful. But contrast the experience of the UK minimum wage and the US minimum wage. The Blair government put in place a minimum wage. I've translated pounds into dollars at the equivalent of $1.75 in different years. The pound is worth a different amount, but you get the notion. And the British minimum wage has increased about 40% since 1999 and is now the equivalent of about $8.84. Let's see, what's the rate of change in our minimum wage? So the UK experience, this is from Tim Smeating of Syracuse and Hills and Sutherland of the UK. These are slightly different measures in the UK and the US, but basically they're both absolute measures of poverty. And what you see is Tony Blair's post-declaration success looks a lot like the U.S. post-War on Poverty declaration success, a dramatic reduction in child poverty. And if you go in and you actually look at the details of the initiative, you see that The poorest 10% of families with children received a bigger increase in income from these programs than did the next 10%, et cetera, et cetera. And so these policies clearly have been able to reduce poverty, and the last time I checked, the British economy had not collapsed because government had gotten more concerned about the well-being of the poor. I thought one couldn't talk about poverty now without saying something about poverty in the aftermath of Hurricane Katrina, where I think for a very short window, a number of us thought we might have a new dialogue here about anti-poverty policy. I think a lot of the dialogue that did go on was misguided. There, I think, is a perception in the population at large that the desperate poverty of the Ninth Ward of New Orleans is somehow emblematic of poverty in the U.S. It's clearly among the most desperate poverty, but again, the best research, a study by Paul Jargowski, published by the Brookings Institution, says that only about 10% of all the poor live in areas of concentrated poverty like the Ninth Ward of New Orleans, and only about 20% of the African American poor. Most of the poor are scattered across the country in every community and are a heterogeneous group, and the kinds of policies that I want to talk about do not focus specifically on place or race, but rather focus in general on raising the employment and earnings and work of the less skilled, and would, I think, significantly reduce poverty. I'm not going to argue that it's going to resolve the problem of concentrated poverty or racial segregation. I'm also not going to argue that we need to expand welfare. We clearly have reformed welfare in a way that we're not going back. The legislation dramatically changed the social safety net. It's no longer the case that people can stay on welfare forever, which was one of the complaints prior. Millions of single mothers have left welfare and taken jobs after the '96 reform. And the good news is that poverty for single mothers is now lower than it was a decade ago. So there's no evidence that welfare reform, on average, was poverty increasing. On the other hand, in any month, 20 to 30% of former welfare recipients are out of work. They work in unstable jobs. And despite their increased work hours and earnings, about 40% of them remain poor. So the good news is, if you went from being the welfare poor, you would have a poverty rate of about 70%. If you become the working poor, it falls to 40%. That's good news, but 40% is not, I think, what President Johnson and his advisors envisioned. So what would I suggest? I call this a modest anti-poverty initiative. I think we could cut the poverty rate in half by expanding programs and policies that have either already been implemented here, the UK, Canada, or other countries. Examples include raising the minimum wage, expanding the earned income tax credit, especially for childless workers and for those with 3 or more dependents, subsidizing health insurance for low-income families not covered by Medicaid, making the per capita child credit and the daycare credit in the federal income tax refundable, changing the unemployment insurance program to cover a greater percentage of low-wage laid-off workers, and providing transitional jobs of last resort for those who want to work but cannot find jobs. Raising the minimum wage is the simple example. I've shown you the British trend. The minimum wage here was typically about 50% of the average wage. So in inflation-adjusted terms, the minimum wage was above $6 an hour in every year between 1962 and 1983. The highest inflation adjusted was in 1968, when the minimum wage adjusted to today's dollars was $7.44. A number of states already have a higher minimum wage. Wisconsin is at $5.70, Florida $6.15, Oregon $7.25, to name a few. And again, my reading of the evidence is that their economies have not collapsed after they raised the minimum wage by these amounts. Seems to me that raising the minimum wage by about $1.50 now and indexing it to average wages would represent the kind of path that Blair has successfully set in the UK. Second example, I borrow from a Republican governor, Tommy Thompson of Wisconsin, who put in a policy called Badgercare, which essentially allows poor families who have income above the Medicaid limit to buy into their S-CHIP program, State Child Health Insurance Program. That's relatively simple to do. It just costs money. A more ambitious policy, I think, is particularly important because of the changing economy and welfare reform, and that's transitional jobs of last resort. We're not going to raise cash assistance for those who want to work but can't find jobs. But now we have a situation where people can't get on welfare and or they've exhausted their unemployment insurance, which typically expires here after 26 weeks. And it seems to me that the federal government could put in place a transitional jobs program, certainly to start on a relatively limited basis. The jobs could be administered by nonprofit or community organizations. You could have the federal government pay 80% and require the organization to pay 20% to make sure at least that they're not just doing this to take the federal money. You could have the workers perform tasks for which they're typically done in better areas, monitoring of playgrounds, neighborhood maintenance, assisting the elderly, but which for their many central cities in particular, the city governments can't afford it. Wages in these transitional jobs would have to be lower than the minimum wage so that the workers would have an incentive to take any available job, and you might limit participation to a year or two. But I do think that's probably the most difficult part of my agenda to put into place. I'd be very happy if we could just do the first few and make sure that those who found jobs, and the soundbite goes, work hard and play by the rules, would not find themselves in poverty. To sum up, I've argued that without an expanded anti-poverty initiative, there's not any reason to expect poverty here to fall much in the near future. What we've been seeing for 30 years are rises and falls around the business cycle. I guess one can say there's a little optimism about what's happened. The boom of the 1990s was certainly a wonderful one, and if we could get back that kind of economic growth, the situation would certainly be good. But we haven't been able to sustain the growth of the 90s over long periods of poverty. Despite our compassionate response to the poverty exposed by Hurricane Katrina, it seems if one goes back and reads the Michael Harrington quote, the difference today between us and those of us thinking about this in the late 1960s is that we've come to have a higher tolerance for our high poverty rate. Thank you. I'm happy to take some questions.
From what I've seen, the poverty rates among single mothers are much higher than those among mothers with husbands. You haven't talked at all about programs to encourage young women and young men to postpone pregnancy until the time when they become more economically able to care for children. Does that play any kind of a part in it?
The chart that the question is about family structure. It's clear that poverty would be somewhat lower today if fewer children lived with single mothers. But my point is that the key reason poverty is high today, because there's been this enormous increase in the percentage of men who earn less than $9.50 an hour. So I'm arguing that this effect is a large one. I mean, I'm not an expert on demographic change. The current administration has something called the Healthy Marriage Initiative. Yes, it would help if fewer children lived in single mother families, but I'm saying it would help a lot more if men and also women earned more or had higher after-tax income.
You haven't done any regressions to talk about trends in unmarried motherhood.
This chart essentially is my saying that the demographic change we had caused this much increase in poverty. If I do it Becky's way, I get it maybe to 3.5, but that economic growth is more important than demographic change. George?
Sheldon, I've always been struck by the fact that child poverty is really adult poverty. And I haven't looked at it in detail, but I suspect that the reason for calling it child poverty is that it's an attempt to build a stronger base because we can't blame children for being poor, whereas many people blame adults for being poor. Can you talk a little bit in your view about why that strategy of calling it child poverty really has not engaged our population to see this as a problem?
I briefly mentioned the attitudes where the public here is much less likely than the public in other countries to trust government to do anything. So I think there's first, we are less likely to believe that we have a responsibility to the poor, and we are less likely to believe that government could be successful about doing something if we give the government funds. And in my notes, I was skipping some things, but I'll read this. It's difficult to mobilize support for an anti-poverty initiative because another Pew poll taken after Hurricane Katrina reported, quote, Americans who view government as almost always wasteful and inefficient increased from 47 to 56% between December 2004 and September 2005. So in other countries, there's more a belief if we give the government the tax money, they will effectively do it. We have less willingness to provide the tax money and less faith in the ability of the government to carry it out.
You could argue that in the case of elderly poverty, that was not the case.
I think in some sense the dramatic success of the war on poverty for the elderly, everything came together in the right place at the right time. Social Security benefits were indexed for inflation to take it out of the political process exactly at the time when we had a huge increase in inflation. So Social Security benefits never would have gotten as high as they are today had it not been for some changes set into motion. There's also the other issue that the benefit, most of us, if you think of the public, most of us feel that we are not going to be poor, and so poverty programs are relatively of little benefit. Almost all of us aspire to live to retirement, and almost all of us have elderly relatives, so we see my mother's in the hospital and Medicare is paying the bill and I don't have to, and we see, boy, that's a good government program. I think some of that is that those programs were in the right place in the right time, and if they hadn't been done then, I think in the post-1980s era, we wouldn't have seen a big increase for the elderly. Way in the back?
How would increasing the minimum wage to $6 or $7 an hour increase the number of men earning over $9 an hour?
There'll be some push up. In other words, whenever you raise the minimum wage, there's some employers now paying $5.50, some employers paying $6. They hire their workers at the minimum wage and give them increases. You'll get a push up the whole ladder. A lot of the men earning less than $9.50 earn less than $7, less than $6. I was just using that as a cutoff. Jeff?
I thought that your discussion of the British programs underemphasized, and maybe this is just based on my own interaction with those programs, the sort of New Deal side, which you just mentioned. And the way that I've seen this talked about by some British people is it's sort of two sides of the same coin. We increased a lot of benefits, raised minimum wage, and stuff like that. At the same time, they had their own kind of version of welfare reform, which in a sense was much broader because their welfare system was much broader. It didn't just touch single parents, it touched everybody. And they went from a system where basically you could keep getting a check forever without ever doing very much to a system where, particularly for the young, they lean on it pretty hard. And I was wondering what you thought sort of the relative importance of those two aspects of the reforms were.
In terms of child poverty, these are the key ones. Basically, the point is you used to be able to be a 20-year-old kid, graduate from school, and get welfare and stay on welfare. And they came down hard on people without kids, and they got them off the welfare rolls. Well, we did the same thing. So that part looks very much like us, too. The difference is when their people are now forced into the labor market, they're forced into the labor market with a better rising minimum wage. Now, there undoubtedly will be some people who were knocked off the dole and didn't work. Interesting, in our welfare reform, basically in all states, single mothers, as long as the kid gets to be about age 2, are expected to work. The UK is getting tough, as I understand it. When your kid is 11, you have to come in for a talk with a caseworker, and you don't have to work until your kid is 14. So again, certain things, I'm not arguing that that system would play here. Similarly, I think our 26 weeks of unemployment is too short. I recently heard it's 4 years in Denmark. That's probably too long, but I'd be much more comfortable with a year in the U.S. as consistent. So I'm not arguing that we ought to adopt a wholesale European social safety net, because it won't fly here.
Yeah, are the Social Security benefits and Medicare and Medicaid indexed to average workers' wages or to the consumer price index? And which do you think is most appropriate, and what would you do to extend medical coverage to Americans in general?
Well, that gets me well beyond my expertise. Provost Gramlich is our campus expert on Social Security. But the point for my talk is that the benefits of the elderly are indexed each year for inflation. There are other issues about indexing to wages for those of us who are still working and how it will affect our retirement benefit. But basically, the big increase in Social Security relative to worker wages came in the late 70s when inflation was 10, 11, 12% a year. Workers were getting 1 or 2%, but retiree benefits were going up 11, 12, 13% a year.
Do you have any opinions as to why welfare reauthorization has been delayed for so long? And I guess secondly, when that reauthorization happens, are you optimistic about any of your proposals being included in that package?
Actually, I think welfare reauthorization happened in a bill that passed. Am I right, Kristen? Maria? Yes. Happened in sort of was tacked onto a bill in December. I would just say welfare reauthorization hasn't dealt with the issues that I'm talking about here.
I'm curious, you mentioned that, well, you have your proposals here, and I'm wondering if you think that there's a certain kind of attitude change that needs to happen in order for these kind of ideas to gain momentum. Right now, the administration talks about, making marriage work. Is that something that you think would be a good idea for something like this, or do you just think the general war on poverty again, or like in Great Britain, something focused more on children?
I think these policies are reasonable policies which would raise the employment and earnings of low-skilled workers. If, for whatever reason, one can also bring about demographic change, that's terrific. I don't think these policies are high on the agenda. Certain ones we have a generous earned income tax credit for people with 1 and 2 children. I think where it could be raised would be particularly single persons and childless couples. If you have a child poverty initiative, that's not going to do much for that. So a minimum wage, obviously, that would affect people with and without kids.
Sheldon, why don't you take one more, because we have I wanted to invite people to a reception next door, but why don't you take one more question and then we have a reception. So.
Yes, when I look at the increase for minimum wage, and also look at housing prices, I'm wondering how the two would ever catch up, because housing prices, no matter what you did, unless you tripled the minimum wage, would still not afford people decent housing.
Well, again, the whole issue of the Section 8 housing program and housing policy is a whole other area which I have not touched on. I want to go back to end with a line, if I can find it quickly, that I skipped, which is a fitting end. Well, I'm not going to find it exactly, but Robert Lampman in 1971 said something like, ending income poverty is a modest goal. What I've been talking about is income poverty, and he went on to say some people will still live in bad housing, and there are a lot of other dimensions of disadvantage. So really what I've been talking about today would be as I say, a modest anti-poverty initiative to cut income poverty in half. Thank you.